listeners, welcome to the MedReach Podcast by MedReach Knowledge-sharing Forum, top-notch talk with healthcare experts. I'm your host Roshna. Let me give you a quick insight about what is MedReach Knowledge-sharing Forum. We are the only forum to focus on healthcare management knowledge sharing. Our forum helps you to connect with healthcare industry experts. MedReach Knowledge-sharing Forum is the right place to share best practices, interesting queries and articles respect to the healthcare field. Today to join with us we have Mr. Arunprasad, who is a healthcare improvement professional with over 10 years of working experience. He received his Bachelor of Physiotherapy from Dr.MGR University, India. He did his MSc in International Healthcare Leadership from the University of Manchester, UK. He also pursued his PG certificate in Patient Safety and Quality Management from University of Calgary, Canada. Mr. Arun is a fellow of International Society of Quality in Healthcare. He is a member of American College of Healthcare Executive and an active member of Planetary International Patient and Family Partnership Council. He is working as a quality officer currently in King Saud Medical City, Riyadh. His area of interest includes patient-centered care, operation research, healthcare leadership, patient safety, and quality improvement. Hi, Mr. Arun. Welcome to the MedReach Podcast.
Hello, Roshida. Thank you so much for welcoming me. It's my pleasure to be here to share my knowledge and skills over this network.
So much. So I have gave a gist about you. Can you elaborate on the same with us by starting with your self introduction?
I'm a healthcare improvement expert, most passionate about ensuring that the patient care meets all the six dimensions of care quality with improved patient experience and high value for the money spent.
Nice. So thank you for your self introduction. Getting into the podcast to start off with, what is person centered care? Can you share us what is person centered care and why there is a lag?
Yeah, actually, person-centered care simply means putting the patient at the center of healthcare and organizing the care around the patient's need and desire. Many people think that person-centered care is perhaps just about giving whatever the patient wants or just sharing every information to the patient, but it is about treating patient as an individual and as equal partners in the business of healing. The patient-centered care has many definitions, but Institute of Medicine defines person-centered care as providing care that is respectful and responsive of an individual patient preferences, needs, and values, and ensuring that the patient value guide all the clinical decisions. Um, so it means like not only involving patient as a partner, we also empower the patient, we teach the patient, we educate patient, and give all the necessary information to the patient, and let him to be part of, let him to be a partner of decision making in his own health. So actually, persons and a care is not actually a model of care, whereas but it's a mindset where it's a total shift from traditional provider driven and disease focused approach. The olden day we just followed. Physician centered model, doctor centered model, but doctor is the one who decides what to be given to the patient, what kind of care should be go to him. Either he will just go for surgery or he will not go for surgery. So everything depends on the provider or doctor. So this mindset is totally changing from provider into a patient-centered approach where we empower patient, we educate patient, we give right information and tools to the patient, so he will be educated about his disease and his issue, and he will take decision along with the physician support. Actually, it's simply you can tell like in my term, it's not about traditional providers versus patient, rather it's a provider plus patient versus disease.
Like it's more of important to educate the patient before treating. So if that's what the patient centered care is focusing on, then absolutely applauses to it. So moving on to the next question, what is the benefits of patient centered care, and can you share some of its real benefits with us?
Okay. Actually, person-centered care is now widely recognized as a foundation to safe and high-quality healthcare. The benefits are for everyone, not only for the patient side. The benefit is for the although for the providers and also for the organization which provides person-centered care. So research has shown that person-centered care improves clinical outcomes of the patient, such as improved quality of care, safer treatments, improved patient experience of care, and decreasing hospital visit due to improved self-management, because patients know about his disease. He knows about how to manage his disease. So the necessity of coming to hospital like readmissions will be less, and you will have improved quality of life. This is for the patient. And if you see at the providers level, like doctors and nurses, they will have better satisfaction. Okay, by providing person-centered care, you see patient is getting improved, patient is happy, so you will normally your satisfaction will go high, and also it will decrease the burnout. It will decrease the mental stress and work stress. We call it as a burnout. It will decrease the burnout. Then, if you see at the organization level, these measures like person-centered care measures or person experience measures acts as a benchmark for healthcare organization. One can easily pick an organization which really focuses on patient-centered care, who is respecting the patient, who is valuing the patient. So the organization will stand out of the competition. And also the measurement of patient experience, like patient experience survey, patient satisfaction survey, these kind of tools will help the organization to improve their processes and clinical outcomes, and also helps us to properly utilize our resource and improve their safety system. So it's actually helping organization to improve their process and system, which is a very good benefit for the healthcare organization. And again, when you see at the look at the business perspective, all the organization wants their customers to return. Also, they want patients to refer the hospitals to other friends or to their family, and provide positive word of mouth about their healthcare experience. So, providing healthcare, patient-centered care has many benefits at three level, like provider level, patient level, and for the organization level.
If patients get good care, of course they're gonna recommend it through the positive word of mouth, as you said. So it's a mutual benefit for everyone, like organization, patient, and also. So, like how the organizations can adopt this PCC, or how the healthcare
Yeah,
professionals can do it.
yeah, it's a great question, actually. Globally, the healthcare systems and organizations are really looking to improve their health system performance through the implementation of person-centered care. However, many find it hard to embed it in their daily practice because its incorporations needs a lot of changes. It's need new skills, cultural shift, and also need collaboration between patient and the providers and various stakeholders. So for me, there are a lot of strategies that an organization need to concentrate in order to embed person-centered care into their health system. So first thing is leadership. So leadership plays a fundamental role in helping person-centered care to be successful in their organization. So it means like leaders should be visionary, and he have to create a vision for the organization, which is person-centered care. So incorporating person-centered care to be part of vision. Okay. Second thing is creating an organization culture is very essential after leadership. Organization that supports patient-centered care, which includes having person-centered care as part of hospital vision and mission statement, is very important. So you must have person-centered care as part of your vision and mission statement. A great example comes from Mayo Clinics. We all know that Mayo Clinics is number one health system in the United States. So they have clearly mentioned in their vision statement, the best interest of the patient is the only interest to be considered. Okay, this is their vision. But they said it before 110 years in 1910. Dr. William J. Mayo said that the best interest of the patient is the only interest to be considered. And still, it is fundamental principles of Mayo Clinic vision and mission and the way of doing business. So that's why they're number one health system in the US. So these kind of explicit statements should be present in the organization. So this can be only done by leadership with right culture and right vision. Then, of course, supporting the workforce to commit the person-centered care is also yeah, really needed because we have to empower our staffs to know what is person-centered care and how to provide person-centered care at every time. And the next one is creating a system that regularly measures and monitors person-centered care. In quality, we say is that without measure, you cannot manage. So it's vitally important to measure your health system performance through uh, patient experience surveys and patient reported outcome measures. So, or through patient compliance. So these measures will help you to improve, and you'll say where you are and how you need to improve. Then also partnering with patients. So partnering patient is the thing that is a high level of strategy. But as an evolving organization, you just need to concentrate on those things. But partnering with patients will really help you to take it further. Okay, so it can be done like through having a patient and family partnership councils. Those kind of councils are very active in West, and now in India, I think it's normal. It's a new thing. So those kind of things can be really helpful for organization to embed person-centered care.
So, vision and the leadership is being mentioned as an important determinant for person-centered care. And why leadership in healthcare is so important and unique?
Yeah, that's a great question. So, strong leadership is critical to transforming the healthcare landscape of today because healthcare is undergoing massive transformation. Either you take it as a digital transformation or changing models of care or increasing consumerism. We call it as consumerism in healthcare. Patients are now increasingly viewed as an empowered consumers. This effect comes from we call it as an Amazon effect. Okay, so they're increasingly viewing healthcare as a product. So they not only wants good healthcare, they want the best healthcare with very good experience. Like they don't want to have a lot of waiting time. They don't want to be poor care, unsafe care. So patients are really empowered customers. So we need to adopt those changing trends. So leadership is fundamental in transforming the healthcare industry. The healthcare leadership is unique because the healthcare industry is very unique and complex. It cannot be compared with any other organizations like IT or finance, or you cannot really compare because there are a lot of involvements of multiple stakeholders, different professionals working together for the pay for common goal. So it's really difficult to organize everything under one system. And if you see, the nature of service is totally different. The customers are fundamentally different from normal situation. They may be with anxiety. They may be sometimes with grief. So all those situations can happen. So you cannot just run it as a business and drive for profit. You have to prioritize the patient clinical outcomes over your profit. So that's why healthcare leadership is very unique, not only in terms of incorporating person-centered care, but also in adopting all those new trends. So healthcare leadership should be strong and fundamental.
That's really well said. It must be strong and fundamental. So today there are like many non-clinical people are also in the leadership role in the healthcare industry. So what are the qualities they require to be in it as a healthcare leaders?
Yeah, actually, leadership is almost like leading an organization, but in the healthcare, yeah, other than having management and leadership skills, you need to have few other extra skills actually. But I call it as BEC, BEC. It's not BEC, BEC. So it's like be curious, empathetic, and continuously learn to continuously improve. These are the three qualities I believe healthcare leaders should have. The first is be curious and visionary. It is very important to have vision when you work in healthcare industry. In addition, more important that your staff need to know this vision. This is called a shared vision. So the leadership will create the vision, and he he clearly translate this vision into an organizational priority. Okay, and staff need to buy this vision. So this is very important. So you have to be visionary, and you have to know how to translate this vision successfully into people. Second thing is, an unique thing about healthcare leadership is empathy. So it is the empathy is the ability to put yourself in someone's shoes and walk alongside them during the times of sorrow. So this will really help to understand the people, stories, and issues, which is actually a good way to improve the system and process in the healthcare. Then the third one, continuous learning to continuous improvements. So as I said, today's healthcare is undergoing massive transformation, not only digitalization, changing patients' requirement and changing models of care. Therefore, to adapt, one need to be continuously learn and continuously improve himself and the organization. So I feel these three are fundamental for either a person from comes from non-healthcare background or a person comes from healthcare background. But for some of the healthcare background, like doctors and nurses and therapists, it's normally, empathy is normally, they may have empathy in part of their experience, but for the non-healthcare, they have to learn it, and they have to do it.
Each and every part is like very clearly explained that of course the leaders should have empathy who's from non-clinical background side. They can't just take it as a lethargy as other things. It's been well said. So like most of the places we are talking about patient experience, how to measure the patient experience.
Yeah, that's an important thing. Patient experience is about how patient feels about the care he received during his whole journey in the hospital. Actually, patient satisfaction, we just measure whether the patient is satisfied, neutral, or not satisfied, those kind of thing. But in the patient experience, the patients are asked to mark on different domains, like communications with nurses, how good their communication with the nurses. There are scores, and how the responsiveness of the health hospital towards their needs, and how their communication with the doctor, how long doctor met the patient, how his communication, whether he shared all the information about the patient condition to the patient, and how is environment of care, like hospital environment, whether it's clean, whether it simulate the home feel, whether it's not well furnished, can meet the patient demand, all those things. And also about pain management. Suppose if you go for pain or injury, so how well he managed his pain, and assess how easily he can assess each and every part of the healthcare. Okay, and discharge information, whether while he going for discharge, whether he got all the informations. Okay, he knows how to manage himself in when he go homes, whether his family is properly educated. So those kind of things. So it's a holistic approach, like holistically assessing whether the patient is satisfied in all those components of hospital journey. So this is called patient experience, and the patient experience measure is very very important today. You know, because it is one of the important quality measures nowadays, and consistently emphasized by many research, that patient experience is really important. So one of the example is, if you see the Institute of Healthcare Improvement, we call it as IHI. Many of us from the healthcare, they know what is IHI. Their framework is called as triple aim. So triple aim says that we wanted to improve the patient population health per capita. We wanted to decrease the per capita cost of care, We wanted to increase the patient experience of care. So these three things are called triple aim. So almost patient experience is given more importance nowadays. So measuring patient importance plays a crucial role to improving the organizational performance and excellence. Secondly, measurement of patient experience is important because it also provides opportunity for the healthcare organization to know where is the lag, where we are doing mistakes, where are we doing mistakes. So whether we have problem with communicating with the patient, whether we problem with physicians, whether we have problem with the nurses, whether we have problem with the environment of care. So it's help us to assess ourselves. Patient experience is really important, and measuring patient experience really helps organization to evolve themselves.
So you mean to say that patient experience like a base of everything.
Yeah, that's true, Rashna.
So how do you see the healthcare landscape of today compared to the past?
Yeah, actually, I have mentioned it a few times while I was asking you other questions or answering your other questions. So the healthcare landscape of today has drastically changed, really, mainly driven by technology, increasing demands from the patient, and coupled with higher patient expectations. So I'm sure that patients are different today than in the past. Today, patients do not just want excellent care; they just want excellent service, and with increased convenience. No one want to wait for a long time like in the olden days. We wait for a long time to get our emergency in the emergency care. So we don't want to wait. As a result, just providing high quality care alone is not sufficient to meet the expectation of today healthcare consumers. So the healthcare organizations need to rethink their approach and need to deliver beyond just improving their just treating the patient. They wanted to maximize the value. So they have to think from the customer point of view. So how we add value to the customer. So this is value is an important term in healthcare. So what is value in healthcare is like it's your outcome divided by your cost. Suppose you go for the hospital and you get very high quality care and with low cost, that is the high value. But you go to hospital B, you get very poor quality of care, but the cost is very high. So the value is low. So from the patient perspective, I got very low value. So this is very important in the healthcare today. So that organization need to concentrate on how to improve the outcomes of the patient, not only clinical outcomes, also the patient experience outcomes, and how to try to decrease the cost, or they have to at least try to match the cost with the outcome. So organization really need to think about it.
The technology has been the main thing today. So, what are some of the future trends that are every healthcare organization needs to embrace in order to stay competitive?
Yeah, actually, we have almost discussed all those things which are organization how to adapt for the future challenges. I'm again going to summarize it actually. There are three fundamental new strategies that need to be embraced by healthcare industry in order to stay competitive. So first thing is, as I said it, putting the patient at the center of healthcare. So patient is the real judges of quality. The patients. So we have to um, uh, just concentrate on patient, what he wants. Okay, how to empower patients, how to involve him as a real partner of care. Okay, so these kind of things is the first priority. The second thing is shifting the volume to value. So in the earliest days, the amount of service a healthcare provider performed or the number of patients treated was the major metrics in the also call it as fee for service model. If we treat more patients, we get more money. But we don't know how the patient is satisfied, what is the quality of care, and all those things. But this is now changing. People are demanding value for the dollar they spend. And then, so we have to really concentrate on improving the value rather than concentrating on the volume. And the third thing is adopting the information technology. Health information technology present numerous opportunities for improving and transforming the healthcare. It helps us to decrease the human errors. It improves the clinical outcomes. It facilitates the care coordination. It improves the practice efficiencies and helps us to really tracking the data. So in healthcare, we have a lot of data. But after we have very good information technology now, we can really utilize the potentials of data in healthcare. Um, so, so these three things like providing patient-centered care, shifting from volume to value, and embracing the information technology. These three things is necessary for any organization in order to perform better and stay competitive in the market.
Nice share. Whatever you have said, you just shortened it very sweetly. So, mm, for all these things, considering all these things, what is your message to the professionals who are upcoming in the healthcare industry?
Yeah. So one of the the myth in healthcare management nowadays is uh, healthcare managers often believe that only providers should be service oriented and empathetic. It means like doctors, the nurses need to be empathetic to the patient. They have to think about the patient, how to caring, how to compassionate. But whereas the managers are a business people, we just need to manage people and helps our organization to drive profits and achieve results. So that's totally not true. So one of the important thing for the healthcare leaders is empathy. So I firmly believe that healthcare leaders and managers should always think from the patient perspective. They have to see from the patient perspective of healthcare. So how it is if I am as a patient, how if I receive this poor care, how if I'm receive this unsafe care. So what is the cost of unsafe care to his family? So a lot of patients die because of medication errors. A lot of patients die because of a wrong procedure or wrong surgery. This is happening in the healthcare, and we are actually celebrating the Patient Safety Day. Actually, today is the Patient Safety Day, World Patient Safety Day. So uh, I emphasize the importance of being empathetic and thinking from the person perspective. As Dr. Juran says, he's a quality guru. He once said that if organization that focuses on customers, they really outperform with any other organization. So you don't need to think about how to improve the profit. You just think from the how to improve the patient outcome, how to improve the patient experience, how to give good care and safe care to them. So it will automatically improve your brand loyalty and it will drive the profit.
Seriously, those are the great words from the quality guru, and thank you for remembering and sharing us today. So, uh, we are almost at end of the podcast. So, can you share your favorite books and the person who inspired you the most?
Yeah, actually, I'm always a great follower of a lot of people, inspiring people's. I'm almost same like the MedReach vision is to be, to let the people from the health information, healthcare management to introduce to the thought leaders. So I also have I normally follow a lot of people and read a lot of books actually. My most favorite people are, I can say, like there are people from healthcare and also non-healthcare. In the non-healthcare, I love Elon Musk. Elon Musk, known by everyone. The great thing is his ability to transform his vision into a successful business. He's a great entrepreneur. So everyone has a vision, but he turns into a successful business. So that's what I love with Elon Musk. Also, favorite healthcare leaders like the president, ex-president of Institute of Healthcare Improvement, Don Berwick. Of course, many of the healthcare management professors know him and they follow him. And Michael Porter is a Harvard Business School professor, and he is the person who introduced the concept of value-based healthcare. He's still acting as a professor in the Harvard Business School, and he established a prize called Michael Porter Prize for Health Economics. And also Henry Mintzberg, he's one of the leadership author and professor from McGill University. So these are the few of the guys I really follow and regularly listen to their speeches, and I follow their YouTube channels and all those things. I also recommend people who are interested to read healthcare management leadership to go through a book called Management Lessons from My Clinic. Okay, so there was a good book. It has mentioned about all the struggles and how they successfully implemented my clinic system of management, okay, and all those things. That's a very good book. And also Juran's Quality Essential for Leader. That's a great book. So these are the few things I can suggest for the upcoming healthcare management professionals.
Wow, it's really a peculiar pickup and great one to know about all these books. So, thank you so much, Arun. We are done with the podcast, and thank you for sharing your knowledge today. It was one of the awesome episode. So, yeah, good luck to you.
Thank you so much, Rachna, for the opportunity. Actually, it's my pleasure being here to always share the knowledge to the people. Okay, so not only to the people, I also wish you should reach to the patient. Okay, that's the ultimate purpose of purpose of ourselves. So we have to help patient to educate and empower and take their health forward, so that it will really helpful for the health system. So thank you so much, and looking forward.
Surely, Arun. Thank you so much.
Yeah, bye bye.
Bye bye. Hello, listeners. If you have any doubt regarding this episode, follow the topic in our MedReach Knowledge-sharing forum. Thank you for listening. Hope you all enjoyed the session. Keep gaining the knowledge with healthcare industry expert by MedReach Podcast through MedReach Knowledge-sharing forum. Until the next episode, take care.